IBS is a common condition that affects the digestive system, and it can be very frustrating to live with and manage. Stay tuned to learn more about why people get it and my top tips to help manage it. IBS stands for Irritable Bowel Syndrome, which is a long-term condition of the lower bowel. We often consider this diagnosis in people who have symptoms like abdominal pain or discomfort, or a change in their bowel habit, or even bloating. IBS can also cause flatulence, nausea, fatigue, and passing mucus from the back passage. When I see people in clinic with numerous issues and one of them sounds like it could be IBS, I tend to do a 30-second IBS screening test by asking 2 questions. Have you had abdominal pain at least 1 day a week for the last 6 months? If yes, have you experienced 2 of the following symptoms? Pain with bowel movements, pain with a change in frequency of bowel movements, and pain sometimes associated with constipation or diarrhea. If you answered yes to both of these, then you might have IBS. For example, overactive nerves or muscles in the gut. This causes extra messages to be sent from the brain to the gut. This can often be related to stress. Another one is oversensitivity to pain. Some people are just more sensitive to pain in their gut than others, and we don't know why. And the other one is infection and immunity. IBS can often be caused after an infection or due to abnormalities in the body's defenses in our gut. We think IBS is caused by any one or more of these mechanisms malfunctioning, resulting in a reset of our gut to a heightened state of excitation and oversensitivity. The chances of getting IBS increase with genetics. You're about 3 times more likely to get IBS if a close family member has it, or if you've had a recent tummy infection or inflammation. Diet's important too. 90% of people find that foods such as alcohol, caffeine, spicy and fatty foods tend to trigger symptoms. And drugs too, such as antibiotics, can make things worse and trigger it, especially longer courses of antibiotics. And finally, psychosocial causes via the brain-gut axis. Did you know that about 50% of people with IBS relate the beginning of their disease to a stressful event? It's important to know that IBS is often diagnosed from the history. There is no blood test or imaging or scan that can confirm this. If you have some of the initial symptoms mentioned earlier, such as bloating or abdominal pain and altered bowel habit, I also want to know how long has it been going on for. Remember, we only diagnose IBS if you've had these symptoms for at least 6 months. How severe are the symptoms and how does it affect your life? Do you have mainly diarrhea or constipation or a mix of both? This definitely affects the treatment plan. And what other symptoms do you have? And your lifestyle. Are there any obvious food triggers or any current ongoing major stressors? And do you have any red flags or worrying symptoms such as unexplained weight loss or blood mixed in with your poo or no desire to eat? One of the most important things for patients with any chronic condition, and IBS is chronic, is to understand it. This is particularly true for IBS, as there is no one treatment that works for everybody, and the path to diagnosis is often long and full of anxiety. When I've asked patients what they're most worried about, it's almost always cancer. So understanding why this is not cancer can be just as important as understanding IBS itself. The management plan always needs to be highly individualized to the person and the symptoms and actually the psychosocial situation. It's really important to have a plan should symptoms flare up. On the prevention side of things, it's important to practice good bowel habits. Try to be regular. This can be a few times a day or even a few times a week. It's different for all of us, but it's good to have some sort of schedule if you can. And avoid holding on to wind. Release it in an appropriate place and avoid straining on the toilet. If you do strain, consider the abdominal brace position. General lifestyle measures are also really important too, and being mindful of this is key. Remember, most people with IBS have a sensitive gut and sometimes can be triggered by things like stress, anxiety, and depression. Diet often needs to be reviewed too. Aiming for general healthy dietary guidelines may not be enough, as some people can be very sensitive to fiber, which is generally a health-promoting addition to any diet. It's also important to identify trigger foods for your symptoms and reduce or avoid them. Some general rules of thumb include reducing things like onions and pulses, apples and fruits with stones, milk, high-fat dairy foods, spicy foods, and fatty meat. Exercise also has a good and positive effect, and some people also find gut-directed hypnotherapy and relaxation therapy useful too. Things to consider. When it comes to medications, drugs are an important part of the toolkit to manage IBS symptoms. For constipation, certain laxatives such as psyllium husk, which you can get over the counter, may help. It retains water, increases the mass of your poo, and it stimulates bowel movements. If this doesn't work, there are other types of laxatives that can be tried, including a relatively new one called linaclotide, known as Constella, which decreases abdominal pain and stimulates bowel movement. For diarrhea, an anti-motility drug can be used, such as loperamide. This is exactly the same drug you may take if you go abroad to treat travelers' diarrhea. You can buy this over the counter too, and it's fine to use short-term for a bout of troublesome diarrhea. If you've got abdominal spasm, peppermint oil capsules are really helpful with minimal side effects. And if you've got abdominal pain, things like deep breathing and a hot bath can help. The main drugs that provide relief when it comes to pain are mebeverine, this is also known as Colofac, and Buscopan. These work by relaxing the gut muscles and relieving spasm and distension. There is no cure for IBS, but that doesn't mean it will be with you forever. When we look at studies, for up to about 2 years after the diagnosis for IBS, about 50% of people will continue to have the same symptoms. In my experience, the cases that worsen always have ongoing stress and mood issues. Today's take-home messages are: IBS is really common, with about 1 in 5 people suffering from it. It causes a lot of anxiety and discomfort, and it's worth getting checked out if you're not sure what's going on. A clinical history, blood test, and stool test is enough to point us in the right direction. IBS is multifactorial. Many things affect its onset and course. Diet, stress, genetics, all of these things play a part. Symptoms can be managed very effectively with targeted, common medications, some of which you can get over the counter. If you found today's topic useful, don't forget to share with your friends and family and click the subscribe button to stay in the loop. Thank you so much for watching. Till next time, stay healthy.